to do that. The other thing is that we will generally see that the baby dies within seconds. So sometimes parents will say, I didn't hear them cry out. Did they suffer? But they die within seconds. There doesn't seem to be a struggle in that respect. The other thing is that sometimes people will think that these babies have suffocated, and this is not a suffocation. This is a different kind of death.
Does the research help us in any way to help lower or minimize the risk of sudden infant death syndrome?
Well, as I mentioned, we really don't know what causes SIDS, but there are some tips that we can have present within a home or within a daycare setting that would lower the risk of a child dying of SIDS. I'd like to take you to a sleeping area where I could show you some of those things. This is a good example of the sleep environment that we're looking for. First of all, it has a firm mattress. And the other thing that we're looking at is that the mattress does not have any space between the rails and the mattress itself, so that there's no space that the baby's face can get down in there and get suffocated. The other thing that we don't want to see, and what we would call a bad surface, would be a waterbed, a beanbag chair, anything where a baby can get their face into a pocket and not be able to breathe properly. The other thing is that we don't want any stuffed animals in here with the baby while the baby's trying to sleep, like she doesn't have any now. Again, so that the baby can't get their face up there with something that they couldn't breathe properly. The other thing is that we don't want the room too hot. A lot of times with babies we think we need the room hotter than it needs to be. If you're comfortable, the baby's comfortable. Then we want a smoke-free environment. We don't want an environment where anyone's smoking or there's passive smoking going on. This makes a higher risk for SIDS. The last thing, and the reason that we're seeing, and we feel that we're seeing a decline in SIDS, is because of back to sleep. And that is an initiative that we're seeing all worldwide on putting babies on their back to sleep. Now, this will not prevent SIDS 100%, but what we're seeing is a very drastic reduction in SIDS by putting babies on their backs.
We asked Pat to describe what to do if an occurrence of SIDS takes place in a child care home. She said the first thing to do is call 911. Pat then went on to explain what would happen next.
First, the EMT would arrive, the emergency medical technicians. Then the police would arrive. And sometimes this is very hard on people because they will come in and start a criminal investigation because they don't know what they are walking into. Then at that point we also will have the ME or the medical examiner come, and they will be the one that will examine the child and pronounce the death. One of the things also that we need to remind people is an autopsy will be done. This is the only way that we can verify if this is SIDS or not, or if the child died of something else.
Before we finished our discussion about SIDS with Pat, I asked her about the guilt that a child care provider might feel after experiencing such a tragedy. She had some helpful advice.
Well, I think it's important for a provider to remember that as long as they've given the best care possible to that child, that they really have no reason to feel guilty. Nothing is probably going to take away the inevitable sorrow that a provider is going to feel in losing a child. But one of the things that they have to try to remember, or hopefully will remember, is that no one knows what causes SIDS, no one can predict SIDS, and there's no way to stop SIDS. The other thing is that we do have support available.
Pat Dameron, thanks so much for visiting with us today. We really appreciate it.
Thank you for having me.
And those numbers that Pat mentioned are on your screen right now.
Another all too familiar tragedy is a situation you need to be made aware of. Shaken baby syndrome can result in severe injury or death. Dr. John Stemke, the head of pediatric emergency at Children's Hospital in Oklahoma City, spent some time with us to explain how to identify shaken baby syndrome and what to do. He also continued our discussion about child abuse.
This is Dr. John Stemke. He leads a team of health professionals at the emergency room at Children's Hospital here in Oklahoma City. Doctor, thanks so much for taking time to talk to us today about child abuse.
You bet, David. Good to be here.
Now, our audience is made up primarily of child care providers, so I'd like to start the discussion by talking about the procedures that someone needs to follow if child abuse is suspected.
Sure. And it is important for daycare workers, child health providers, child care providers to know their law and the procedures to follow in their locale and their state. Every state is slightly different, but there are common denominators of dealing with this. If a daycare worker truly suspects abuse and neglect, then they're obligated by law to report it to their appropriate authorities. That may be a child abuse hotline. That may be their local child welfare offices. But certainly every daycare, child care provider should have a number, know the number to call, so indeed they can make that report of suspicion.
Doctor, doesn't the law require providers to report child abuse?
Oh yes, it does. But I want to stress that it's what you're reporting is a suspicion of child abuse. And I think a lot of people become confused with that term, and I think that can be intimidating to a lot of folks because they say, gee, I'm not sure I know what it is, or do I have to prove it, and do I have to investigate it? And I think the important thing is just to recognize that the way the statute is written, and in most states, and certainly in Oklahoma, it's the suspicion of abuse and neglect. And if you, in your job, profession, as a child care provider, if you have a reasonable suspicion of abuse or neglect, then the law requires you to report that suspicion. And it's also important to recognize that the law doesn't require you to have to show it. The law, you have satisfied the legal requirements if you've just reported that suspicion. Then that suspicion is reported to child welfare. Child welfare is expected to investigate, and the results of that investigation is made available to the district attorney's office. Now, in many states and many arenas, if this suspicion comes out of a daycare center, then usually that state's agency relating to licensing of daycare or child care providers is involved in the investigation. But I think that should make it an easy process for any person to do. This, you pick up the phone and say, gee, I'm concerned.
So it's really the reporting of the suspicion that's the important thing.
Absolutely. And all you're going to be asked is, gee, why are you concerned? And it's perfectly all right to be concerned. In fact, we want that. And the law recognizes also that sometimes you'll have concerns that it really is an abuse. And that's also okay, because you'll never get into trouble for reporting a suspicion of abuse, even if you're wrong. And that was recognized up front when the reporting legislation was passed. Yes, there's going to be erroneous reports.
Right.
And that's perfectly okay. And because the whole purpose is to protect the child and to provide services to families. And so the child care provider has no responsibility in investigating. It's just a matter of reporting a suspicion, and the law protects you from any retribution by virtue of making that report, even if you're wrong.
Most injuries caused by child abuse are pretty easy to spot: bruises, burns, broken bones, and so forth. But I'd like to talk for just a minute about something that may not show outward symptoms, and that's shaken baby syndrome. Now, could you please tell us a little bit about what shaken baby syndrome is and how those injuries are caused?
Oh, you bet. Unfortunately, it's more common than many people think, and it's a major cause of death and morbidity in children, particularly under 2.5 years of age. We see approximately 1 to 2 such children a month in this very emergency department. And not infrequently, these children may be brought in from child care facilities. And the cause is almost universal. A principal caretaker losing control with the child. They've had it. They become very frustrated. Usually the child's crying, gets on their nerves. They may be under stress from other things, and then they just lose it with the child. And they grab the child, usually by the chest or around the arms, and violently shake the child.